The new year comes with the promise of a much faster pace of pushing the coronavirus out of Minnesota. Good evening. Thanks for joining us. I'm Amy Hockert.
And I'm Kelsey Carlson. Minnesota's vaccination efforts are off to a slow start, and we're not alone. Theo Keith joining us live. And so state officials do vow that that is going to change. But how will that change, Theo?
Yeah, so far, Minnesota hasn't even used half of the vaccines that it has gotten. But now, health officials are saying that they will get a shot into the arm of every willing healthcare worker and long-term care resident by the end of this month. Over the past 5 days, 40,000 Minnesotans have gotten a shot. That's the best stretch yet after a start slowed by training requirements and federal cutbacks to Minnesota's vaccine allotment. Monday, health officials pushed back on concerns.
But I think it's important for you to know that Minnesota is on track. And the patterns that we're seeing here in terms of our administration are very similar to those of other states.
According to the CDC, Minnesota has used just 37% of its vaccines. That ranks in the middle of the pack, 22nd, just ahead of Wisconsin. South Dakota has the highest percentage, using 62% of its vaccines. Kansas ranks last at 15%.
Being 22nd in the nation is unacceptable.
Republican Michelle Benson, who chairs the powerful Senate Health Committee, is planning a hearing next week. She is frustrated over what she sees as a lack of clarity about the state's rollout.
There's a lot more questions, and this has sort of gotten to be a pattern. They're not being transparent and upfront with us.
Minnesota officials say a shot will go in the arm of every willing healthcare worker by the end of the month. And they say major pharmacy chains that are handling the work in long-term care facilities promise to be done in 3 to 4 weeks. By month's end, health officials say they will start vaccinating other frontline workers, including teachers. That timeline means some Minnesota teachers could be back in the classroom later this month before they get a shot. Governor Tim Walz's administration now estimates that the vaccine rollout, which will be the state's biggest in its history, will cost $134 million. The feds will pick up some of that cost, though it's not yet known how much. Meanwhile, health officials say they have not yet heard of any wasted or spoiled vaccines in the state. You remember, over the holidays, a pharmacist at a hospital in suburban Milwaukee was arrested for allegedly spoiling more than 500 doses of coronavirus vaccine. Kelsey?